Teşekkür ediyorum Sayın İlhan Hocam.
Thank you very much, Ilhan. Distinguished guests, I know we're running out of time, so I have to start immediately. Actually, I'm going to talk about mental health promotion and substance abuse prevention. So I know that the interest is higher when it's done contrary. So why are we talking about preventative healthcare systems, especially in youngsters? In psychiatry, we try to treat one person. That's how the system was established. But in the world, we have an aging population, and the population is aging very fast. They're using more and more pharmaceuticals, and we know that there is huge interaction among different cultures. These interactions can be positive and negative, and individual needs and requirements are more in the forefront compared to family interactions. Well, they told me I had to speak in English. İlhan, how do you think I should continue? Maybe Turkish? All right. Anyone who would like to listen to him in English? Okay. It comes to me naturally, and you know, in 3 days I adapted myself to my native tongue. All right. The slides will be in English. I'm sorry. Anyways, we have to look at the preventative healthcare services, because rather than treating once they're ill, we have to start treating before they become ill. Well, you remember from public health classes, we have different classifications of prevention, like primary, secondary, and tertiary prevention. But now we have target population-based approach, which can be classified as universal, selective, and indicated preventive interventions. This was published in IOM report in 1994. In terms of prevention, of course, the interventions need to occur before the onset of the disorder. But the treatment is interventions for the individuals who meet or are close to meeting diagnostic criteria of a condition. But what we're trying to underline here is that we need to think about prevention. So we have to become prevention-minded clinicians or teachers or healthcare professionals, however you want to name it. These you know well. You know what primary prevention is. You know what secondary prevention is. There are some risk groups for the disease. Maybe 1 or 2 symptoms are present, or he used substance 1 or 2 times, or he started smoking, but he's not an addict yet. Maybe he smoked only 5 times all his life. So these could be prevented on a secondary basis. In tertiary prevention, of course, this limits physical, social consequences, and AMATEM is the institution which is responsible for tertiary prevention. Here, universal preventive intervention targets a whole population or general public. So we take measures in order to prevent all the youngsters to start smoking, or we can prevent them from continuing smoking. Selective preventive intervention will target individuals or a subgroup of the population with risk of developing a condition. In the selective group, the risk group is much bigger. For example, in psychiatry, we look at postpartum depression. This is important because we see postpartum depression in many women, and we need to educate these women and their caretakers, and we need to monitor these women. Why prevention for the youngsters? Because we see that most of the addicts start using at an early age. For example, 26% of high school students had reported current cigarette use in the USA for the last week. And when you look at the other substance, I'm not only talking about tobacco, the early starters have a higher risk of developing addiction. And early adolescence is the first phase. I'm going to proceed fast. This is between 10 to 13 years of age. Thought patterns are largely concrete. Primary reference group begins to change from family to peers. Experimentation with new behavior begins. The abstract thoughts begin, and sense of invulnerability remains. These are between ages of 14 to 16, and they have the enormous influence of peers is important. These are late adolescents, between 17 to 19 years of age. Abstract thought allows realistic assessments. Family and peer influence is more balanced. Their risky behaviors decline. The smaller circle is the person, is the individual. The second one is the family. The third one is school. The fourth one is his environment, the community he is in. And the biggest one is the society. This is developed by CDC, and this is a social ecological model. So, it identifies the biological and personal history factors. The second level includes the family and peers, and it's important in identifying the risk factors. And as the other panelists said, all these groups and institutions need to be taken into consideration. Let's take a look at tobacco prevention programs in the States. These have been tried and proven efficacious. These are included in the literature, so I can give you the details later on. These are elementary school kids. This is Protecting You, Protecting Me program. So, the kids are informed about the harm of alcohol use and smoking. This is a program which was started for the kids who were older than 6 years. So this is like a vaccination program. And there is life skills training. So this is a school-based training. We teach them a lot at schools. For example, we teach a lot of history, geography, so we know a lot of things about most of the places around the world, but maybe we have to focus on other individualistic stuff. So, TMI, sometimes we say too much information, which is unnecessary sometimes. So, our brain capacity is limited, so we have to give them the necessary information. They don't need too much information that they will not use. So life skills training will play an important role to develop new skills. And we're going to talk about substance abuse, about tobacco, about alcohol, and this is how we should educate our children. These are applied programs, and they have proved efficacious. These are 3 different programs. Here you see a program for ages between 8 to 13, 11 to 17, and 13 to 17. They are not all about chemicals and tobacco. And they also improve or develop mental health of these people. When you inform these people about mental health, maybe we can make sure that they will protect themselves from tobacco and alcohol use. So these are such programs. Risk factors for smoking in the youngsters. If there is someone who smokes in the household, of course the teenage will say that, okay, that's not something bad, so I can do this in the future. how many of you was smoking and quit smoking? All right. Well, I did an experimentation when I was in elementary school, and I smoked, but then I quit, of course, because it's very important to quit and then to continue like that, because sometimes you quit and then you start a couple of years later. But if you don't start within the first 5 years, then the restarting rate will go down to 10%. So if you're thinking about quitting, it's a good sign, because we know that nearly 25% of all smokers aim to quit, but they don't do it. But I strongly suggest it. So we know what the risk factors are. And high levels of aggression and rebelliousness in boys and preoccupation with weight and body image in girls are the risk factors. You know, with this diet frenzy, everybody is on a diet, because 30% of the population is obese and the other 30% is overweight. So this is like a social pressure, and we see a lot of eating disorders, and everybody is preoccupied with their body image. They think that their body image is what defines them, especially in junior and high school, and this increases the risk of smoking. This is primary prevention. This is secondary prevention for smoking. We need to detect people who just started smoking. And for tertiary prevention, of course, the treatment of cigarette smoking and nicotine dependence in order to reduce morbidity and mortality. Of course, we're trying to decrease disability, to decrease the risk of diseases, and decrease the risk of mortality. As you know, 1 out of every 2 smokers dies due to smoking-related causes. So this is something you can prevent very easily. This is the most common cause of death that can be prevented. We used to talk about plague, now we're talking about smoking and substance abuse. So these are the 5 A's for intervention. So you need to ask about smoking status, advise the patient to quit if the patient is coming to see you. So you need to prepare the patient, so you have to motivate them, because they may not be ready, but you need to motivate them. And then if they are ready, then we set a date to quit smoking, and then we support them with pharmacotherapy or with nicotine patches or nicotine replacement therapies, or sometimes acupuncture works, and hypnosis sometimes works. There are some evidence, but for hypnosis and acupuncture, we cannot say it's not that easy to implement for all cases. Okay, let's proceed. This is an important public health problem, and especially in mental illness patients. We know that the rate of smoking increases. 90% of schizophrenics smoke. Of course, there are different neurotransmitter causes. Some people think that it's good for some cognition, and there are some trials to develop new drugs. And especially in psychiatric patients, we need to look at the use of smoking, alcohol, and tobacco. That's what the literature states anyways. Okay, we talked about this. What about in adolescence and before pregnancy? Because everybody wants to have a healthy child, so this is a good reason to quit smoking. So maybe we can talk to GYNs, and we have to talk to young couples that they have to quit smoking 6 months before they start to get pregnant. Some of them will not be ready, of course. We can get them ready, and we can treat them we can educate them about the risk factors, so we can implement CBT for these patients. When we look at successful quitters, we see that they have self-confidence, and they were not heavy smokers. They smoked light, or maybe they smoked only for a couple of months. They smoked for fewer years, and this is not a habit, but this is like a social smoker. I mean, when the peers smoke, he smokes, but when the peers do not smoke, he doesn't need to smoke. As there are some CDC recommendations for schools to prevent tobacco use, they say that all schools should develop policies on tobacco use, and they say that for each grade you need to establish some targets, because a student can see that his or her parents smoke, but if you educate them about the harms of smoking, maybe the child will learn that it's harmful for his health, and he's going to try to make his parents quit, and he will never start smoking. And we should also offer support to teachers who should quit smoking, because they will become very good role models for the students. Or seniors who quit should work as counselors for the younger students. Let's talk about alcohol use. As you know, it's a wider problem in the States. But as Dr. Mega said, our use is 40%, so it's increasing. And there is some binge drinking. This is especially true for college students, especially on the weekends. They start on Thursday evenings, and they drink till Monday morning. And they binge drink every night, and they get intoxicated. I think this is one of the biggest headaches the universities have in their campuses. Of course, we need to start with certain programs in order to control the risk factors, so that the patient will never start it, because this is a number needed to treat. This is NNT. Of course, we have to have trials on that, but maybe if we have a program for 10,000 people, maybe we will be able to prevent 100 of those people to start smoking or alcohol use. So we will be able to prevent other related problems, such as cardiovascular diseases, cancers, and respiratory problems. So this is going to be a win-win for the person, for his or her family, and the society at large. I'm running out of time, so I'm going faster. Health promotion is very important, because physical health promotion is not enough. We have to try to prevent diseases before they are developed. So there are some studies on diabetes and cancer, and we have to focus on psychiatry within that regard. There is some literature in the States starting from 1980s. In 1986, the strategies for health promotion was described in the Ottawa Charter by WHO. You aim for the well-being of the person, and the quality of life should be at the highest level. This is how the health or the well-being of the person is described. So we see that nearly 8% of young people had an MDD episode within the last year. And we know that depression is a chronic and recurrent disease. So these kids should be treated, they should be educated, and we know that the response rates go down with every episode. So the earlier we can intervene, the better the outcome and the prognosis will be. Here you see the physical fight. I think the data is also higher in Turkey. In a 2007 US nationwide survey, we saw that 36% of the youngsters said that they were involved in a fight within the last month. So these are the mental and emotional health programs which were applied and were proven to be effective. As you know, there are 50 states in America, and these are different programs which were used in different states of America. We can talk about it later on. And there is a missing link. You know, the implementation has been coined as the missing link when disseminating evidence-based programs into service settings. It's easy to talk about the program, but it's more important what the clinician, what the doctor is going to do. There are some factors that we need to take into consideration. Of course, you need to follow up those principles. You have to understand what lessons they have learned, and you have to have a teamwork. Unfortunately, in our culture, we don't have a very good teamwork. You see it in our economy. You see it in family companies, but when you look at the German companies, they are all, incorporated companies rather than limited family corporations. So, they're much more successful. So we need to adapt to teamwork. There are 6 stages here. The first one is exploration. The second one is installation. The third one is initial implementation, then full implementation. It is followed by innovation and the training of the newcomers and sustainability. How are we going to maintain this program in the future? You need to have sustainable development, otherwise it's going to be like in the States, you grow a lot and then you scum. So you have to grow continuously, albeit slowly if it's necessary. There are some programs. These are the online resources. You can read it later on. And thank you very much for your attention. Thank you very much, Mr. Chairman. Thank you very much, Professor.